students from LGS Phase 1 and we'll be asking you questions regarding anorexia.
Alright, so anorexia nervosa is basically an eating disorder, and when you look up the internet for studies that are being done in Pakistan or they have been done in Pakistan, you wouldn't find a lot of statistics that are, that could give you an exact answer to your questions. But I did do some research when you sent me the questionnaire. So there have been studies specifically with medical students in Karachi and in Islamabad. Some of the medical students and nurses reported the symptoms of anorexia based on a clinical scale, and we came up with numbers that were exactly the same average numbers that we see in the Western society. So let me just quote something for the reference, that in female population it is around 5% of the entire population, and in men it is relatively less, it's around 2 to 2.5%. These are the gender based differences. Talking about Pakistan, so for example, in a data of maybe 1100 students, we saw that maybe 27% of them were reporting symptoms of anorexia. But please let me just remind you that these studies are basically based on questionnaires and scales. They are not based on clinical examination. So anorexia cannot be diagnosed unless you do a clinical examination on a patient. So it is very safe to say that the average number does fall in the same category as the Western numbers. And I'm quoting studies from metropolitan cities. The data is still not available from rural areas, far-flung areas where maybe these symptoms are present but they're not readily reported to the doctors. So there is a huge need of research further in this area. Yes, I think so. Why I think so? Because the first person you ever contact when you're not feeling well is your general practitioner. For people in Pakistan, there's always a family doctor. But women and young girls, they're always accompanied by parents when they go to visit the general practitioner. So I don't think that GPs question for eating disorders in particular when they're doing their physical examination. It would be a chance that they notice that somebody has dropped a lot of weight, or maybe somebody is not looking as well as they used to, if they know them personally or if they've seen them before. People don't come up to the GPs and explain these symptoms. It is usually later in the stages when anorexia is fully developed that psychiatrists come in need, and it is then that these things are identified. So it is being misdiagnosed on the primary healthcare level, which means that the GPs are not identifying it, and the consultants or the specialists come to see it much later, where the cases are obviously to a point where medication is needed. So yes, there is a underreporting of these cases. Well, we would need authentic data to say whether the correct answer for this. But in my personal experience, the little practice that I have, in the last 5 years, I've seen more number of cases in anorexia as compared to when I was in training. So this can be just a rough estimate. Yes, the number is increasing. So remember that anorexia is not just an eating disorder. It is also related with self-esteem. It is associated with worth and the body image of a person. And I think with the rising trends in social media, the negative body image that we've created for ourselves, and the unachievable, I think it's a completely unrealistic pattern that we want to achieve. So with the rising trend in these social media trends and otherwise as well, I think that yes, this could be one of the reasons. Of course, there are genetic implications, then there are patterns of eating, and don't forget the society that we're living in. We're living in a society that is highly critical of the female body, and maybe it's a thin body or whether it's an average size body or a heavy body, everybody is critical of it, and there are certain even people who do fall in that category, in the category of that perfect body type, they do have low self-esteem. So yes, the number are increasing. I've mentioned I've highlighted a few reasons for that as well. All right, let me just, I don't have an exact figure for this, but would it be safe to say that maybe 1/3 of the cases go unreported and the 2/3 do present to the clinics and they do present to the doctors? But even when they do present to the doctors, they do not go for follow-ups or for continuous management. So we don't see such patients returning to our clinics the third time or the fourth time. They usually lose follow-up. All right. So when you pull up the data, of course, research is only done and it is only seen or visible on the internet when it is reported. So doctors in South Asia and Southeast Asia are not very active in putting up their research publications on the internet. Western doctors are more active than that. But I think that areas like Southeast Asia, we are a low middle income country. So remember that such cases are readily reported. They might be reported as cases of depression and anxiety, and when you take the history, you do understand that there's a eating disorder that's lurking behind. So Southeast Asia, because I work here, so I can represent the clinical population that I see. I believe that it could be one of the hot spots in the entirety of Asia. Yes, I think that this is a topic which is a very extensive debate. We all are from Southeast Asia. From South Asia, and we know that it's in the fabric of our society that women, first and foremost, I think the generational. I think it's a generational thing. It's very easy for people in our society to comment on body types, and they don't find it offensive, and it's very, very common for girls to receive compliments as well as critique on the type of the body that they have. So mothers telling their daughters to eat in a certain pattern or to restrict certain kind of caloric food in order to look good, to be presentable to the society, because of the fact that some of the lower middle income families only raise daughters and they're concerned about their future in a way, who would get married to them, where would they get married. So one of these factors majorly contributes in our country. Other than that, we have also seen that women in our country are, they don't have a lot. I don't think that I'm talking about you guys, but the other type of the population that I'm talking about, the lower middle income people who are not able to express themselves, they don't have a very good self-esteem. So body image or related any issues that pop up, they don't know how to express their emotions. This can be one of the reasons that we see such cases on the rise. This trend is on the rise. Alright, so advocacy is a primary thing that we all need to do, because I think number one, eating disorders are something that are prevalent, but they are not talked about a lot. It is usually a habit to hide your eating patterns if they are deviant from the normal, what is considered to be the normal. If people are restricting food, they will not be talking about it. If they are on certain kinds of extreme diets, they will not be really talking about it openly. Exercise and other routines are not readily taken up. It is usually assumed that after restricting food or eating certain kinds of diet, you can lose weight. Exercise and other behaviors are not promoted in the society. So number one, I think that talking about these issues starting from home, and the parents making it an environment that the children are readily able to talk about their issues, that I feel a certain way, I look at the mirror and I feel this way. Did you feel like this when you were growing up? So talking about like puberty, I think a young girl who's 11, 12 years old suddenly is faced with so many problems of how to dress up, how to hide herself, and not to be seen or not to be visible in the society. There's a lot of pressure on Pakistani women in that reason. So dealing with that, along with the expectation of looking in a certain way as well, and then you have to stand out. You want to stand out in your peer group. You want to look beautiful. There is an ideal in your mind, whether it's a celebrity or whether it's somebody from your class. You want to look that way. So I think first and foremost, it's the duty of the parents to make the children aware about these things, that you can develop this. It is normal to feel shy about your body. It is particularly okay to feel not good in certain dresses and not good on certain days. That type of talk, of course, can build the self-esteem. I think that being a doctor, I've realized that it's very, very important not to educate your children to get good grades. It's very important to educate them to be emotionally intelligent and socially intelligent, and letting them know that they can express themselves no matter how they feel. So, ek to ye, number one. Number two, I think schools should create such awareness from a very early. I think this course should be taken very early on. It should not be taught at the level of Cambridge and otherwise. It should be started at the lower primary level. Before puberty, women and men, they have equal chances, so they should be provided those chances. Pre-pubertal pre-pubertal girls should be given the opportunity to know about what nutrition is, what a balanced diet is, how diet can affect us, and how exercise can be incorporated. I'm not talking about hardcore exercises. I'm talking about other things like yoga and meditation, and there are so many other ways like self-defense strategies. These things should be explained. So parenting, schooling, peer groups, support groups, these are the ways that we can, if somebody has gone through such a thing and you notice one of your peers suffering, if you notice one of your colleagues suffering, so I think it's important to let them know that this is how I dealt with it. And developing a good relationship with food. When Maha sent me this question, I was thinking that German women are not told not to be strong and sturdy, but Pakistani women are told to be petite and young and slim, in that way. So why don't we accept that the Pakistani natural body is voluptuous, it is curvy, it is, you can be a woman in Pakistan and love the way that you are, but of course it's a thing that it would take time to have these conversations. So one thing that I've noticed is that we don't love the food that we eat. So developing a good relationship with food, not having guilt associated with the fact that we ate something junk or we went away from the normal routine. Most of us have never visited a nutritionist. We've all been doing the diets just by looking at websites and just by hearing it from others that what is keto, what is other the other fads that are around us. So we need to go and see a nutritionist if we actually think that we are overweight. Interestingly, most of the girls who are average weight, who are in the normal weight, consider themselves to be overweight because they don't have ever calculated their BMIs. So first and foremost, awareness about how to diagnose an eating disorder, what a BMI is, when to contact a psychologist, when to see a psychiatrist if you are developing feelings of anxiety. Please remember that eating disorders are only the tip of the iceberg. Underneath, these children are very shy. They're very anxious about their bodies. So yeah, these are some of the ways. And just to mention, all of these people who have eating disorders, when they are scored on various psychological tests, a type of personality called perfectionism, or a trait of personality, is identified in them. So they will need to sit with a clinical psychologist in order to reduce this attitude कि perfectionism achieve करना है कि okay 1 kg weight will cause unhappiness to me. This cognitive bias has to be removed because weight is not bringing you happiness, other things are. So I hope that these could be some strategies that can be used in order to prevent it.
Thank you so much.
That's the end of it?
Yeah,
Okay.
thank you so much.
No problem at all.